All right, so you want to sound like a heart health pro. Like you could explain the latest in heart surgery without missing a beat.
Well, get ready, because
This is bad at
that's
first.
exactly what we're doing.
Thank you there.
We're going behind the scenes.
We are diving deep into
The very latest in cardiovascular care.
the coolest, most cutting-edge heart care out there. Our source, the SurgiMind Podcast, an episode all about, you guessed it, the future of fixing hearts.
And let me tell you, it's a pretty exciting time to be talking about this.
I bet. Just skimming through, they were talking about open heart surgery, but not the way it used to be, you know? They made it sound almost like easy.
Okay, easy might be pushing it a little.
Yeah.
But the advancements they're making in minimally invasive techniques, seriously impressive. Smaller incisions, less pain, patients bouncing back quicker. It's a whole new ballgame.
Okay, so maybe not easy, but way better than it used to be. And get this, they were talking about using robots during surgery. I have to admit, the first thing I picture is some sci-fi movie.
It's a natural thought. But here's the thing. One of the really amazing points they made was about 3D echocardiography. Think about it. Surgeons can now see the heart in 3 dimensions. Every angle, inside and out, before they even make a cut.
So they can basically plan out the whole thing in advance? That's incredible.
Precisely. They have this 3D model of your heart right there on the screen, which means they can be so much more precise during the actual procedure. It's amazing what technology can do these days.
Totally. Now, they also kept mentioning these terms, TAVR and TMVR, and they made it sound like kind of a big deal. But I gotta be honest, I'm drawing a blank. What exactly are those?
So TVR stands for transcatheter aortic valve replacement, and TMVR is transcatheter mitral valve repair. And you're right, they are kind of a big deal, potentially game-changing for a lot of people.
Okay, now you've got my attention. What makes them so revolutionary?
Well, these procedures are minimally invasive. Instead of open heart surgery, they can go in through a small incision, often in the leg, and repair or replace the valve.
Wow, that is incredible. And that means
Faster recovery, less pain, fewer complications. Especially huge for patients who might not be healthy enough for the traditional open heart approach.
it's literally giving people more time, better quality of life. That's amazing. But it's not all about going smaller, is it? The SurgiMind episode talked a lot about robots and AI, too. Are we getting to the point where robots are going to be doing heart surgery on their own?
That's a question that comes up all the time. It's important to understand that right now, it's all about assisting surgeons, not replacing them.
So enhancing their skills, making everything even more precise.
Exactly. Think of it as high-tech tools. Robotic arms that can move with incredible precision. AI that analyzes tons of data to predict outcomes, help personalize treatments, things like that.
Like giving surgeons superpowers?
You could say that.
Speaking of superpowered, they mentioned something else that sounded almost unbelievable. Regenerating hearts. They used terms like stem cell therapy and bioresorbable materials. Are we talking about growing new hearts in a lab here?
It's not quite that simple, although it's definitely an exciting area of research. Regenerative medicine has this immense potential when it comes to treating things like heart failure. We're not quite at the new heart in a lab stage, but it's early. The research that's being done is really promising.
So maybe not growing hearts in a lab just yet, but it sounds like we are on the path toward repairing damaged hearts in ways we couldn't even dream of before. This SurgiMind episode is basically a sneak peek into the future of heart health, and it's honestly pretty mind-blowing.
It really is an incredible time to be working in this field, and this is just the beginning.
So much more to come. There's so much more they talked about in the episode, too. It wasn't all, the high-tech, futuristic stuff. Like, they talked a lot about how technology is changing the whole patient experience.
Oh, absolutely. Like, even outside the hospital.
Right. Telemedicine, wearable tech, keeping tabs on people remotely. Did I get that right?
You got it.
It's amazing because on the one hand, we're talking about robots and AI, and then on the other hand, it's like, how do we make this whole process less scary, less disruptive for patients?
Exactly. And that's where a lot of this technology comes in. So instead of waiting weeks for a follow-up appointment, what if your doctor could keep an eye on how you're doing in real time?
Wait, really? How does that even work?
Wearable technology. Heart rate, activity levels, sleep. All sorts of data your doctor can use to get a really good picture of how you're recovering.
Wow. It's like having a doctor with you 24/7
Yeah.
without actually, having them there all the time.
Exactly. It can be a game changer, especially in those early weeks after a procedure when you want that extra peace of mind.
Totally. Now, I have to ask, what else really stood out to you from the episode? Anything particularly surprising or interesting?
Let me think. Oh, they had a whole segment on bioresorbable materials.
Oh, right. Like the stents that dissolve after they've done their job. No need to stay in your body forever.
That's the one. Amazing, isn't it? And it's not just stents. The potential's huge.
Yeah.
Imagine rebuilding damaged heart tissue with this stuff. Or even creating new blood vessels that eventually your body just kind of absorbs.
Okay, that is next level. It's mind-blowing to think how much progress has been made. It feels like we're on the verge of a whole new era in heart health.
I agree. And the best part, we're just getting started. There's so much more to come.
It really does feel like we're on the edge of something huge here, doesn't it?
It does.
Like, where are we going to be in 5, 10 years?
Right. It's incredible to think about.
It makes you think.
The speed at which things are moving in this field. It really makes you wonder.
If they can do all this now,
And honestly, we've only just scratched the surface
what's next?
when you think about the potential of all this,
And that's what gets me, actually, because it's one thing to, invent all this incredible technology, but making sure it actually reaches the people who need it.
Now that is the big question, isn't it?
That's the bigger challenge.
Access,
That's the thing.
for sure.
Right.
Something everyone's thinking about, though.
It's good to know they are, because honestly, it seems like every time I turn around, there's some new breakthrough, some amazing advancement in healthcare
Oh, yeah?
and heart health. It feels like it's leading the way.
Definitely one of the most exciting areas, for sure.
Well, we've covered a lot of ground today, from shrinking down surgeries to AI lending a hand, even the whole idea of regenerating hearts. This SurgiMind episode was like a trip into the future of heart health. I mean, wow, what a ride.
Couldn't have said it better myself. I
Yeah.
mean, the progress is incredible.
Makes you feel hopeful, right?
Absolutely.
Well, we're just about out of time for this deep dive, but hey, if you're as fascinated by all this as we are, do yourself a favor, check out the SurgiMind podcast. It's full of amazing insights. And until next time, stay curious.